Welcome to our talk today on modifiable risk factors for cardiovascular disease. We will discuss all the risk factors for cardiovascular disease and talk about the difference between modifiable and non-modifiable risk factors. We will also look at strategies for the management of modifiable risk factors. Risk factors for cardiovascular disease are various lifestyle behaviors, conditions, or circumstances that increase the likelihood of developing heart or circulatory disease. Non-modifiable risk factors are those circumstances that we do not have control over. Examples include your age, gender, ethnicity, and family history. The good news is that many risk factors are within our power to control, and these are known as modifiable risk factors. Let's review these risk factors in more detail. It is well documented that being physically active and getting regular exercise is good for our heart, brain, and body. Exercising consistently is associated with a decreased risk of heart disease, stroke, diabetes, cancer, dementia, and many other chronic health conditions. What you eat and how much you eat matters. Foods high in sodium, sugar, and saturated fats can elevate our risk for cardiovascular disease by contributing to high blood pressure, elevated blood cholesterol, and elevated blood sugar. Excess calories can also contribute to an increase in body weight and an increase in our waist circumference. This can lead to a higher chance of developing high blood pressure, diabetes, and sleep apnea. High blood sugar levels can damage the interior lining of the arteries in your heart and body. When blood vessels are damaged, the risk of developing plaque in the arteries increases. High blood sugar levels can also lead to eye, kidney, and nerve damage. Blood cholesterol, specifically your LDL cholesterol and triglycerides, can contribute to plaque formation and inflammation in the arteries. High blood pressure can damage your arteries and put excess strain on your heart. If left untreated, the risk of developing plaque in the arteries increases. Our heart's ability to pump blood may also become less efficient over time, and this can lead to conditions such as heart attack, stroke, and heart failure. Smoking tobacco or exposure to secondhand smoke can harm almost every organ in the body, including the heart, lungs, and our arteries. If you are smoking cannabis, we know that it contains many of the same respiratory irritants and carcinogens as tobacco smoke. Research in this area is relatively new, but emerging evidence has shown an increased risk for heart disease and stroke due to the effects of cannabis on blood pressure, inflammation of the blood vessels, and cardiac arrhythmias. Quitting smoking is one of the best things you can do for your overall health. Stress is a part of life for almost everyone. Chronic high levels of stress can have an impact not just on our mind, but also our body. Stress hormones such as cortisol increase the demand on our heart by elevating heart rates and blood pressure. There is a strong link between cardiovascular disease and unmanaged chronic stress. New research has shown that all levels of alcohol consumption are associated with some health risk. 1 to 2 standard drinks per week is considered low risk and may affect things such as our sleep quality. 3 to 6 standard drinks per week is considered moderate risk and is associated with developing certain types of cancer, including breast and colon cancer. 7 or more standard drinks per week is considered higher risk and is associated with higher incidences of heart disease and stroke and heart failure, along with other alcohol-related conditions. Sleep plays a key role in overall health. Chronic sleep deprivation, poor quality sleep, and conditions such as sleep apnea can increase our risk for cardiovascular disease, elevate blood sugars, and can contribute to altered eating patterns which may increase our waist circumference and weight. It can also contribute to mental health concerns and a weakened immune system, making us more susceptible to injury and illness. Now that we have identified the modifiable risk factors for cardiovascular disease, let's discuss strategies to manage them. If you are looking to make some behavior changes to improve your risk factor profile, it is recommended to work on one behavior at a time versus widespread changes all at once. Keep in mind that making small, consistent lifestyle changes and building over time is the key to improved health outcomes. The current guidelines are to aim to achieve 150 to 300 minutes of cardio-based exercise weekly. Examples include walking, cycling, or dancing. If you are new to exercise, or if this amount sounds like too much, starting with small bouts of exercise lasting 10 to 15 minutes will still provide you with health benefits, and you can build from there. In addition, aim for at least 2 days of resistance and balance training each week. These exercises are designed to increase muscle strength and endurance and can include activities such as dumbbells, resistance bands, or bodyweight exercises. Speak with your exercise therapist regarding your exercise goals. To improve our heart health, we recommend following the principles of the Mediterranean diet and Canada's Food Guide. Both have a big focus on aiming to eat whole, unprocessed foods as much as possible and aiming to increase our consumption of plant-based foods. Whole foods include vegetables, fruits, nuts, seeds, legumes, and whole grains. Healthy fats can come from plant-based sources such as olive and avocado oil. Fish such as salmon, sardines, mackerel, and tuna are also a great source of healthy omega-3 fats. Whole foods are rich in fiber, minerals, vitamins, and antioxidants. Red meats, processed foods, sweets, and treats should be eaten less often. Mindful eating is also an important concept with a heart-healthy diet. Being mindful means being aware of how you eat, why you eat, what you eat, where you eat, and how much you eat. Being mindful can help us make healthier choices more often. Consider speaking to your exercise therapist for a referral to the program dietitian for more information and to help you with your individual nutrition goals. Regular exercise and following a heart-healthy diet can have a beneficial impact on your blood sugar, blood cholesterol, and blood pressure. In some cases, medications may also be prescribed. In addition, we encourage you to be aware of your numbers for each of these risk factors and have a conversation with your exercise therapist or doctor regarding your targets and goals. If your blood sugar values are elevated, you can request a referral to diabetes education from your exercise therapist or healthcare provider. Smoking and exposure to smoke can harm almost every organ in the body. Reducing smoking with the ultimate goal of quitting is one of the best things you can do to improve your overall health. When aiming to quit smoking, it is important to develop a plan and get support. Speak to your exercise therapist regarding smoking cessation services and resources. Canada's alcohol consumption guidelines were updated in 2022. Instead of a weekly maximum number of drinks, it has been recognized that the risk of negative outcomes begins to increase with any consumption. Therefore, drinking less is better for everyone. The lowest risk category for adverse health impacts is 0 to 2 standard drinks per week. It is recommended that adults aim to achieve 7 to 9 hours of quality sleep per night. Practice good sleep hygiene by keeping a regular sleep schedule, limiting screen time prior to bed, and avoiding alcohol or heavy meals prior to bedtime. If you suspect a sleep disorder known as sleep apnea, speak with your doctor for a referral to a sleep specialist. Stress management solutions are unique to each individual. Finding what works best for you is important. Suggestions include engaging in physical activity and exercise, working on sleep hygiene, gentle yoga, or completing meditation or relaxation exercises. Other suggestions for stress management may include listening to music, reading, hobbies, and maintaining strong social networks. Now that we have completed the talk, let's go through our test your knowledge. Which of the following is not a modifiable risk factor for cardiovascular disease? If you guessed family history, you are correct. With regards to your risk factors, think about any goals that you may be working towards. Is there one risk factor you would like to focus on? If you're setting some goals, think about what went well, reflecting back each week, what went well and what you can do differently. Last but not least, please speak with your exercise therapist in how we can support you in your goals. For more information, you can also visit our website, gethearthealthy.ca, and visit our calendar of live events on our website. Thank you for listening to our talk on cardiovascular risk factors.